Hey, everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Ellen Seppi, and I'm excited to talk with you about something near and dear to my heart that combines both weight loss medication and senior care. So, I'm here to talk with you about the GLP1 Bridge program through Medicare Part D. So, basically, what this program is an exciting program in its experimental phase. So, there's an experimental program through Medicare that basically only charges patients $50 per month to be on prescription GLP-1 medications. So you heard that right. Only $50 to be on GLP-1 medications if you have Medicare Part D. But there's a bunch of caveats. First, understanding that you have to be enrolled in Medicare Part D, the pharmaceutical component of Medicare or pharmacy coverage Medicare to qualify for this program. The second thing is that you cannot have certain diagnoses that are already covered through Medicare Part D medication management. So this was a really exciting program. I talked with a lot of my patients about it because they had been considering GLP-1 medications and wanted to enroll in this program because it was only going to be $50 a month, and that otherwise would have been a barrier for them to take those medicines. That program is established to help patients reduce their weight that don't already have diagnoses where they could get coverage from Medicare to manage other health conditions, specifically diabetes and sleep apnea. So if you have moderate sleep apnea or diabetes, that could be a diagnosis that keeps you from accessing this program. That's really important because if you have a patient who's like, oh, I could enroll in this, it would only be $50, those two diagnoses specifically could keep you from accessing this program. To qualify, you have to be 18 or older, you have to have Medicare Part D, and if your BMI is 35 or greater, you automatically qualify without any other diagnostic criteria. If you have a BMI over 30, you must also have diastolic heart failure, uncontrolled hypertension, or chronic kidney disease. So you have to have those other three comorbidities. If your BMI is 27, you must also have pre-diabetes, not full-blown diabetes, a history of heart attack or stroke, or symptomatic peripheral artery disease. It's really important to remember that if you have type 2 diabetes, you do not qualify for this program because the opportunity to get medication through Medicare is already covered. You can already get a GLP-1 medication that's covered by Medicare if you have diabetes. Also, sleep apnea. If you have sleep apnea, you can get medication, the GLP-1 medication, to manage your diabetes or through another pharmacy program. That GLP-1 program is specifically for people who otherwise wouldn't get coverage to manage their to manage their weight without those other diagnoses. So you might be thinking, whoa, this is a lot of information. Why do I care as a healthcare provider who's not prescribing these medications? Why do I care as an OT? Why do I care as a fitness professional? Why do I care as a PT? Because this expanded access is going to help our patients who have struggled with their weight for millennia, for decades, manage their weight and their health better without having those other diagnostic criteria like diabetes or sleep apnea. So it's important to remember that diabetes is not just a comorbidity. Diabetes isn't just a disease, it's the disease. And adiposopathy, or the sick fat disease that we see from excess adipose tissue causing increased inflammation throughout our body, proposes health risk to our patients. That's why there's coverage for these medications from insurance providers, because they know that somebody's health will be at risk if they're carrying excess adipose tissue. And for sure, we can understand that BMI isn't the best way to capture somebody's risk of disease and how much adipose tissue they have versus muscle mass. But we need to understand that excess adipose tissue is just as dangerous to somebody's health as unmaintained high blood pressure. If you had a patient who had uncontrolled hypertension coming into your clinic, you would refer them back to their primary care doctor. If they had significant swelling throughout their legs, you would refer them back to their primary care doctor. If they had uncontrolled tachycardia, you would refer them back. This is another condition that we need to address as healthcare providers to see, okay, if somebody's weight is uncontrolled, if their adiposopathy, if their obesity is out of control and they've struggled throughout their life to maintain their weight unsuccessfully, that's an indication for us to refer them back and to make sure that we're communicating with healthcare providers. That brings me to my second point, thought bubble as a clinician. Doesn't this increase the risk of osteopenia, osteoporosis, or sarcopenia? Using GLP-1 medications does not increase our risk of osteoporosis beyond other ways that we lose weight. We lose weight and we lose that load on our bones. Great news, with strength training, we can maintain somebody's bone mineral density even if they're losing weight through bariatric surgery, conservative measures like diet or exercise, or GLP-1 medications. If we want to support our patients truly, and we know that they're taking these medications, we need to ensure that we're prescribing appropriately dosed strength training. I'll share an embarrassing example. When I first moved to Colorado, I used a poisonous leaf as toilet paper, and I didn't know. My whole body swelled up. It was miserable, terrible. I'll leave out some details, but when I saw my doctor, he didn't say, okay, open wide, see how much prednisone you can catch. He gave me a dose, and the dose of exercise needed to keep muscle around when we're on these medications shouldn't be left to guesswork. It should take a skilled clinician like one of us to guide these people who are excited to change their health through maintaining muscle mass and bone. That's our job. And I'm going to be real. If it's not our job as healthcare providers, I don't know whose job it is. The doctors don't have time. We know that our patients need this information and they can't necessarily get it from the internet or another source. We are the reliable provider. So first, this is our job to refer back to their provider. We know that these drugs are helpful in reducing weight, and it's our job as clinicians to encourage exercise. Team, so many of our patients are already taking these drugs and losing muscle mass without the guidance of somebody to help them keep their muscle mass around. This is our job, and I'm so thankful that you took the time to join me this evening to talk about how this GLP-1 bridge program through Medicare can help our patients access medications to potentially help save their lives and their quality of life. Thank you so much.